This video will show you how to use personal protective equipment when using standard precautions. Standard precautions are the main way to reduce the risk of transmitting infectious agents in healthcare. They are used for all patients irrespective of their known or suspected infectious status. Personal protective equipment, or PPE, is a component of standard precautions. You need to wear PPE to protect yourself when you think you may have contact with, or will be, handling a patient's blood or body fluids. In this video, we'll show you how to put on and remove gloves, aprons, gowns, eyewear and surgical masks. If you anticipate or know you are going to have contact with a patient's blood or body fluids, you must put on gloves. Firstly, remove all wrist and hand jewellery. Perform hand hygiene and wait for your hands to dry. Choose the correct size gloves and remove them from the box. Slide one hand into a glove so the cuff covers your wrist. Repeat with the other glove. When you have finished with your gloves, use your non-dominant hand. Remove the first glove by pinching the inner wrist part of the cuff on your dominant hand. Roll the glove down over your hand and scrunch it into the palm of your non-dominant hand. Remove your second glove by placing your fingers under the cuff on the inner wrist and roll it from your hand over the first glove that is cradled in your palm. Dispose of the gloves directly into the waste bin. Perform hand hygiene. Apron or gown. If you are anticipating contact with a lot of blood or body fluids, including aerosol, splash or splatter, or you need to protect your clothes from fluids, you will need to put on a sleeveless apron or, in some circumstances, a long-sleeved gown. To put on an apron. Unfold the apron, place your head through the opening, grasp the ties and tie securely at your back. To take off an apron, perform hand hygiene, break the side of the neck strap, roll the apron away from yourself down to your waist, break the waist tie, continue rolling the apron away from yourself into a ball. Dispose of the apron directly into the waste bin. Perform hand hygiene. To put on a gown. Unfold the gown. Slide your arms into the armholes and through the cuffs. Secure the top of the gown at the back of your neck with the ties, tape or Velcro. Grasp the waist ties and tie securely at the middle of your back. To remove a gown. Perform hand hygiene. Undo the waist tie of your gown. Undo the neck tie, tape or Velcro. Pull the gown away from your body. Pull your arms out of the gown, turning the sleeves inside out. Roll the gown down away from your body. Continue to roll until the gown is in a ball. Dispose of the gown directly into the waste bin. Perform hand hygiene. Protective eyewear. If you think blood, body fluids or any other fluids may splash or aerosolize into your eyes, you will need to put on protective eyewear. If you wear prescription glasses, put the protective eyewear over them. Remember to perform hand hygiene prior to and after removing eyewear. Surgical mask. If you think you may get splashed or have exposure to aerosolized blood or body fluids around your nose or mouth, you should put on a surgical mask. Remove prescription glasses if you wear them. Remove the mask from the box. Hold the mask with the pleats facing away from you and making sure the metal nose wire is at the top. Slightly bend the nose wire to form a gentle curve and open the pleats by pulling down on the bottom of the mask. Place the mask over your mouth and nose and pinch the curved wire on the bridge of your nose. Take the two top ties of the mask and tie at the back of your head, making sure the ties are above your ears. Pull the bottom of the mask so it fits snugly under your chin. Take the bottom ties of the mask and tie at the back of your neck. Gently press the nose piece to conform to the bridge of your nose and cheekbones by pressing down with fingers until it fits snugly. Put on your prescription glasses if you wear them. To take off the surgical mask, perform hand hygiene. Remove prescription glasses if you wear them. Perform hand hygiene. Undo the bottom tie at the back of your neck. Undo the top tie and hold onto the ties. Lean forward and pull the mask away from your face. Holding only the ties, place the used mask directly in the waste bin. Perform hand hygiene. Please remember to refer to your local infection prevention and control policies and procedures, as well as these videos.